Welcome back. It's an alarming fact. The United States is still the most dangerous developed country for women to give birth. 700 women die every year, and that's according to the CDC. Black women, we're 3 to 4 times more likely to lose our lives during pregnancy complications. Our next guest believes dismantling structural racism and health inequities is essential to seeing that change. Good morning. I want to welcome you, Stacey Stewart. You wrote about that in an opinion piece. You're the president, CEO of the March of Dimes. Your mission is to help parents and babies. So welcome to Start Your Day and BNC. We appreciate you waking up early with us because it is an important topic. But I can't believe we're still here in 2021. Why?
Yeah, Sharon, thank you for having me. You know, it is shocking. I think a lot of people cannot believe that in the United States of America, we're considered the most dangerous, as you mentioned, the most dangerous developed nation in the world in which to give birth. You know, it's 700 to even 900 women who die every single year as a result of pregnancy and childbirth complications. But the even more shocking fact is that there are another 50,000 women who come close to death and are just shy of actually losing their life as a result of complications due to pregnancy and childbirth. And as you mentioned, Black and brown women, especially Black women, are at risk the most in this, where Black women die at a rate of 3 to 4 times that of white women due to pregnancy and childbirth complications. And you know, these inequities are really rooted in the racism that we've lived with in this country over hundreds of years. I mean, there's really no one point in time that you can think of where Black women have had access to the same high quality health care as white women in this country. And the cumulative effect of that racism over so many years is why we live with these inequities today.
Yeah, so access is the key issue. You co-wrote that piece with Dr. Richard Besser of the Robert Wood Johnson Foundation. So you talked about racism and access, but how do we change it? You know, because don't we have the resources in this country today to simply erase this?
Well, it's just like everything else. We may have the resources, but do we have the will? Do we prioritize women? And do we prioritize and center Black women in this conversation? The fact of the matter is we don't in this country. And that's why it's so important that we raise our voices and advocate for the kind of care that we need, both in one-on-one interactions with our healthcare practitioners, but it shouldn't just be the responsibility of every single woman to fight her own fight. We really need to push for systemic change. That's why the issues of access are so important. Yes, we need access to healthcare providers where we live, and we need to be insured. We have far too many women that are uninsured in this country still, even after Obamacare gave states the ability to expand healthcare. But even more importantly, when we are interacting with the healthcare system, we need to make sure the healthcare providers don't have what we refer to as implicit biases, really this unconscious racism that allows them to interact with us in ways that makes us feel that we're having a racist interaction. We have substantial numbers of Black and brown women who say when they've been interacting with the healthcare system, they feel like they've experienced an act of racism. And that's something we have to stop as well. And we're working on that at the March of Dimes through implicit bias training of healthcare professionals.
Yeah, we've had people as famous as Serena Williams. Serena Williams speaking out about this when she had complications during her pregnancy and childbirth. And you mentioned Black women who often feel, or too often, that they're not being heard by doctors. So it's this implicit bias about that, because a lot of times it seems like some doctors, for all the great ones out there, they don't want to change their bedside manner here.
Well, there are a couple of things about that. One is that implicit bias means that sometimes you're not even aware that you're acting in a certain way. And be clear, all of us have implicit biases about something. But our point is that to the extent that you have some unconscious bias against Black and brown women for whatever reason, we need healthcare professionals to first recognize that exists and then understand what they need to do to address that and correct for that. Because again, we find that it probably is interfering in far too many cases and interactions in the healthcare system. And guess what? It's not just with the physicians. Sometimes it's with the nurses. Sometimes it's with the
Sure.
receptionist, the front desk receptionist when you first enter a clinic or enter a hospital. So really,
Uh-huh.
everyone in the healthcare setting needs to correct those issues and those biases that they may have. But we're also very fortunate, Sharon, where we've got Congress and leaders in Congress on our side. We've got a Black Maternal Health Caucus that is leading the fight on a package of bills called Momnibus. Part of that legislation, those legislative actions, is going to address implicit biases, training healthcare professionals, medical professionals, even in medical school, to try to make sure that when they come into practice, that they are treating everyone, irrespective of race, ethnicity, where they live, with the same kind of care and attention that they deserve. Last thing I'll just say
Yeah.
is that the CDC has said that 2/3 of all these cases of maternal deaths are preventable if we just treat women, listen to women,
Ugh.
respect women, and respond to them and diagnose them and give them the care they need when they need it. 2/3 of all cases could actually be eliminated if we just did that.
Yeah, and I know the March of Dimes because you've written about microaggressions, bias in healthcare. The March of Dimes is helping to train professionals. And so you can talk about that, but also how the money, additional support for moms, can help alleviate some of this.
Absolutely. I mean, through policy change, we need to do far more investing, both at the federal level and the state level, to address these issues. Obviously, we need to expand coverage. We need to make sure everyone in this country has coverage because a lot of the issues in pregnancy and childbirth are really coming because sometimes women are not their healthiest even before getting pregnant. That means we need women to be in their young adulthood, be focusing on their health, focusing on their heart health,
Well,
focusing on their weight. I hate to say it, but focusing on eating
yeah.
correctly and eating properly, managing stress, right? Our mental health, so that when we do decide to get pregnant or when it just happens that we become pregnant, we are healthy, and that will
Yeah.
make sure that we give our babies a healthier chance as well. But investing in our health early on, investing in those interventions to make sure that we're protected in the hospital setting, and also expanding our coverage to make sure that we can still have coverage, especially if we're on Medicaid, 1 year after the baby is born, because we find that one
Yes.
third of all deaths happen even after childbirth. Some of it having to do with mental health challenges, where we still need to be seen by a provider to manage those kinds of symptoms and those issues as well.
Yeah, I like that you give some of the power and say, here are some of the things that you can do right now to ensure the health, or at least give your baby the best chance, give yourself the best chance. Quickly, because we are out of time, where can women go? Because there's a certain set of questions. There's certain things that you may not know. We need to ask these things during this, what should be a beautiful time in a woman's life.
Well, it is a beautiful time. And I just want to say, the vast majority of pregnancies and childbirths do go well. Yeah, but
Yeah.
fortunately, in our community, sometimes they don't. And we don't want to make people afraid about this. We just want to give people the information and the awareness and empower women to demand the care that they deserve. And if you want more information, just go to marchofdimes.org. Join our fight in this, become an advocate for us, but also there's a ton of information if you need
Yeah.
to understand what you need to do to manage your own health. So marchofdimes.org is the best place to go.
All right, Stacey Stewart, we appreciate you so much. President, CEO of the March of Dimes, thank you so much for this really what is critical and can be life-saving information. And do come back because the fight rolls
Oh,
on.
please have
Thanks so
me.
much for joining us and start your day.
Thank